Arthroscopic-assisted suture tape reinforced TFEC repair, and distal radial ulnar ligament augmentation using a modified Adams-Berger technique. The procedure was performed with the patient in the supine position. The operative arm was placed horizontally on an armboard, abducted approximately 90 degrees from the torso at shoulder level, allowing optimal access to the wrist. Step 1. Volar ulnar approach and DRUJ capsular exposure. A 2 mm volar ulnar incision is made to expose the DRUJ capsule. Step 2. Radial bone tunnel preparation and fiber tape passage. A 2 mm bone tunnel is drilled from the volar to dorsal aspect of the distal radius, along the anatomic trajectory of the distal radial ulnar ligament. A spinal needle preloaded with PDS suture is inserted through the tunnel to shuttle the fiber tape across the sigmoid notch. Step 3. Subcapsular fiber tape routing along the DRUJ for ulnar exit. A 4 cm incision is made along the distal ulna. The previously passed fiber tape is retrieved subcutaneously from both volar and dorsal sides of the distal radial ulnar joint capsule, emerging through the ulnar incision in preparation for TFEC repair and ligament augmentation. Step 4. Arthroscopic-assisted ulnar tunnel drilling. Step 5. Arthroscopic fiber tape passage through TFEC. Under arthroscopic visualization, a spinal needle is used to pass a PDS suture through the peripheral portion of the TFEC. The suture then guides the dorsal and volar limbs of the fiber tape through the TFEC and out via the ulnar styloid tunnel. Step 6. Final tensioning and multi-knot volar fixation. With the wrist in neutral or slight supination, the volar and dorsal limbs of the fiber tape are tensioned evenly, each encircling the ulna. The two limbs are then tied together on the volar side of the ulna with 4 secure knots.